is the Investor Connect podcast program. This is Hall T. Martin. I'm the host of the show, in which we interview angel investors, venture capital, private equity, family offices, and many other investor groups for startups and growth companies. I hope you enjoyed this episode. Thank you for joining us. Well, hello, this is Hall Martin with Investor Connect. Today we're here with Dr. Chettiapally, who is a physician, researcher, author, and healthcare innovator dedicated to transforming the future of medicine through technology. With a background in emergency medicine and epidemiology, he is the recipient of prestigious awards such as the Kaiser Permanente Pioneer Award and the Morris F. Collin Research Award. Dr. Chettiapally, thank you for joining us.
Thank you. Thank you, Hall, for having me. It's a pleasure.
Great. So where are you calling from today?
I am here in the beautiful San Francisco Bay Area. The city is called Burlingame, and it's nice, sunny, and 70 here.
That's great to hear. Well, great. Well, let's just get right into it. You work with physician-led innovation. So my question is, how can doctors identify unmet clinical needs to develop scalable solutions?
Well, yes, to be able to serve the physicians and other healthcare providers who are working on the front lines of healthcare. So it's easy because when you work on the front lines, you know what problems you're dealing with. And these are people that have had experience for years and years, and they know exactly what the problems are. Sometimes they come up with solutions, and they are very unique solutions. And that's the best way to create a solution and try to see if there's a market for it, because you understand the problem much better than anybody else. And also, you know if that solution will work because you may have tried variations of that solution. So you may have other ways to find out if that solution will work. And so we say you should play in your domain expertise area. That's the best way to do it.
So how do you drive innovation in healthcare, through physician entrepreneurship and collaboration? How do you get others to join in with you on these things?
So that's the reason, we know that, physicians and other healthcare people that are innovating, they may not have the resources, number one. They may not have the time. They may not have the knowledge or the network to be able to bring that innovation to market. And so we started Innovator MD just to be able to help these individuals. Innovator MD is a health innovation company. And we do that by providing classes, master classes, conferences, meetup, startup showcases where we bring in, investors to look at startups. And also we bring in experts in different areas to talk about things on how to do things. And so we have this whole community built. It's the largest in the country of such kind. And it's a membership organization. So you become a member of the organization, and then you participate, whether you are an expert, whether you are a physician who is looking for things to do, whether you're a startup that has already started on this journey and would like to get feedback and traction, or you're just an enthusiast and a student who wants to learn more about healthcare innovation, and you can join the community as a member. So it's a membership-driven organization.
Oh, that sounds great. So let's talk about funding healthcare startups. What are the challenges and opportunities for the early stage ventures in digital health and medtech?
Healthcare is one of the toughest industries to do a startup in. And the main reasons, number one, it's a huge industry, and there's so many different areas, different players, and most of them are legacy players, which means that they have been in the system for a long time. And they say that this is how it's always been done, so this is how it'll go on. And so it is hard to change. The third reason is it's a very complex system, and that makes it harder for newcomers or startups to enter this area. And that makes it very challenging because when you are a newbie in this huge, legacy system, and you want to introduce something new, it's hard. Plus, the regulations and everything else don't make it easy either. So it is a very tough situation for new startups to get into healthcare. I would say the best way is to find a company that is already in the system and to be able to partner with them to bring this new solution to market. That way you are making sure that you already have, somebody helping you on your side to get it to the market.
Great. So we're seeing a lot of impact from AI and data coming into medicine. Can you talk about some practical use cases improving patient outcomes and reducing system inefficiencies with AI and data in today's market?
Yeah. So one of the big things about healthcare is that it has a lot of data that is being produced every day. And so it is one of the very data rich, data intensive business that is out there. That's number one. And the good thing about having data is that you can use that data to improve things, make things better. But the downside also is that that data is in silos, or it is, behind firewalls, behind closed doors. So it's hard to reach that data. So that's the challenge. But the technologies that are coming out nowadays, especially the large language models and the digital health tools that are, active, you can do a lot of things to improve healthcare administration and the business of healthcare. Now, most people, most of the tools that are successful are, how do you do the documentation? Or how do you do the prior authorization? How do you do the communication? How do you do the appointments, the support for patients? Those kinds of tools are already up and running, and they are doing a great job. But where I see the most impact on healthcare is going to be on the healthcare, the science of medicine, where the science starts to change because you have so much information, and that wasn't, and you have tools that were not available just a few years ago, where you can derive a lot of insights into this data and help change the science so that it improves the outcomes for patients. And that'll soon be happening, and it's already happening in some of the biotech spaces where AI is able to find new candidates for drugs and new ways of treating old diseases. So I'm very optimistic about the future.
I sometimes see solutions that fail because they don't take into account the realities of being a physician, financially, workflow, and otherwise. How do you connect clinicians with investors and tech founders to accelerate that innovation adoption and close that gap?
Yeah, I'm a proponent of physicians involving being involved in innovation early on. The sooner you can get a physician or somebody in healthcare, either nurses or pharmacists, or depending on what your innovation is, getting the domain expertise early on is important.
Oh, great. So let's talk about the healthcare startup ecosystem. What are you seeing there happen today? What trends are you seeing in physician founded companies, here after the pandemic?
Yeah, pandemic has shown that number one, a lot of things can change very quickly. Some of the, big burdens that were laid on physicians and other providers were, leading to burnout and having people work hard, much harder than they used to before. And so, and we also saw that with the pandemic, you saw these new vaccinations and new technologies that came through, especially like telemedicine became very ubiquitous. And so when that people have seen the upside and the downside of innovation, and when people are subjected to this pressure, they try to seek out, solutions for that. And that's why we have seen a lot of physicians and healthcare people looking to do other things. I would say that If you're not connected to a startup, I think it's a good idea to get into a community and get exposure to what startups do. And then try to engage with the startups, whether as an advisor or a consultant. And, if you're really interested as a co-founder of a startup, that gives you a lot more exposure. And there are some physicians who just want to stay on the sidelines and become investors. And these early stage companies are good places to invest, especially if you know the domain and if you're able to help the startup go to the next level.
Well, we've seen the rise of value-based healthcare. How do you think the innovation is aligning with that shifting reimbursement and care delivery framework?
Yes, a lot of the investors and a lot of the companies are looking for solutions to improve value-based care because the current system, the fee-for-service system, is not sustainable in the long run. So how do you transition into value-based care system, which is a very different business model and where patient outcomes are important, for a business to succeed. Technology tools are very useful in that case because then you can use technology to improve patient outcomes, whether it is quality, whether it is cost, or whether it is patient satisfaction. And so all these things come into play, not just generating revenue. You have to be able to improve the quality, decrease the cost, and improve patient and provider satisfaction. And so when you put those parameters into any to apply to any solution, then you get a win-win-win situation where you're developing a tool that will help not only the patient but the provider and also the whole system, making the system much better in the long run.
Well, you've seen quite a bit of experience from the Innovator MD Ventures. What are some of the key takeaways from supporting multiple healthcare startup journeys that you came through there?
Yeah, my job is very exciting because I get a chance to look into what startups are doing. I have a front row seat to innovation, and I can see how things are going to change in the future. And so kind of predicting where things will go, and that is very exciting. Number one, just the ideas and looking at the big picture. The second thing is that is exciting is that I get to meet very interesting people and smart people. These people are out there to change the world. And so that is very exciting and inspiring to me to continue the work that I do to support these ventures. The third thing is, you get to do things that you would not otherwise have dreamed of, making a difference in the world where you're changing things for the better, especially in healthcare where it needs a lot of innovation.
Great. Many physicians are starting companies. What investors should they know about physician-founded startups? How are they different from the usual tech or consumer product goods startup?
Yeah, when physicians do the startups, they are coming from a very high knowledge level into the problem and they understand, how it should be done. Where physicians have challenges is where they tend to treat it as clinical practice. What I mean is that a startup's business goals are very different of a clinical practice's goals. And so that's where physicians find it challenging. And so an investor's main job is to guide these physicians, get them additional help where in the areas where they need help, where they need understanding and knowledge and experience. They may or may not have that experience. And so trying to understand the business side of things and how the clinical fits into that business. And that is the role of the investor, trying to figure out how to make this a successful venture.
Right. There's an explosion of new technologies and new approaches in the market today. What are your predictions for the next wave of technology-driven transformation in care delivery? What do you think is going to be the big game changer?
As I predicted, 6, 7 years ago when I wrote my first book on AI and healthcare, on how AI is going to change healthcare, that is coming to fruition right now as we speak. When I wrote the book, nobody knew what AI was and how it's going to change healthcare. And by the way, if you want to check it out, it's called Punish the Machine. And what we are seeing is that the ease of building new technology, has really improved. So today it is possible that, a few people can do a startup and they can change, how a certain business process is run or how a certain new business model can be implemented. AI has, especially the large language models, have improved, the time it takes to develop something new and test it and keep iterating on it until you become successful. And so that is possible now with a very low threshold for entry into the market, entry into the development phase of a startup. And so that's the beauty that, where you can use those new tools to build startups. And so that has really helped, especially people like physicians and healthcare people understand how you can use technology. In the past, you have to have a very high level of training in software engineering and in coding and all of those things. You don't need that high level of engineering knowledge and skill anymore. What you need is some basic skills. And then once you know that your model is working, once you know that your system can grow and scale, that's when you can get more technical people and more business people. And so that's the beauty of the current technology. And I can see that that will explode in the sense that more and more startups will be formed and more areas will be up for grabs as far as innovation is concerned.
Well, when it first came out, we saw AI go into the, patient management, reimbursement optimization, the digital health side of things. It was a tech solution going after tech applications. And it seems like now it's moving into, creating new medical devices, turning biotherapeutics into drug discovery systems. What do you see on the latter two there? Where do you think that's going to go?
Yeah, so that's a great question. Because initially it was all about business and how to optimize the business of healthcare. And then slowly it came to, okay, how do you make it more convenient for the patient? How do you make it more convenient for the physician? Right? The patient communication tools, the care management, the physician documentation, and all those tools. And where it is going is into the science of medicine, the science of healthcare. And that is where I feel the biggest bang for the buck lies. Because, simple things like, for example, if we talk about annual physical exams, well, we do annual physical exams because, well, that's when you get reimbursed, or that's how you get reimbursed in a fee for service world. Well, does that make any difference for the patient? Does that make any difference in the outcome of a condition? Maybe, maybe not, right? Now you have enough technology and data where you can actually personalize care for the patient and only provide exactly what the patient needs. Maybe the patient needs to see the doctor every 2 years or 3 years. Maybe they should see them every 2 months, right? Depending on that person's problems and the conditions that they have. The second big thing where the technology is going to improve is on predicting what a patient will have 5 years from now or 10 years from now? And how do you change that trajectory into a healthy mode rather than how the patient will become sick? So once you know how to predict, and you will figure out how to prevent that and how to treat that even before it becomes a problem. And so that's where I see the biggest bang for the buck, for these technologies will be. And that can only work in value-based care. It cannot work for the fee-for-service business model.
I'm reading a book on AI, and it makes the case that AI strength is not automation, but rather coordination. In your example of the annual health exam, maybe coordinating your next regular scheduled visit should not be 1 year out. Maybe it should be 6 months out, or 12 months out, or 13 months out. And where's your take on that? The strength of coordination by AI as opposed to automation.
So coordination is the outer layer that you see, but the deeper layer is clearly understanding the clinical condition. That is key. Coordination, yeah, that is happening right now as we speak, right? What is the next step for me to do, or what are the tests I need, or what are the potential medications that I can take. So that is all happening right now. But what I'm talking about is the next level. The next level is where the deep science dictates on what the next step should be, or dictates what should be done next for a patient, or what should not be done for a patient. And, because right now, we almost have this, how should I say, book driven knowledge where, everybody, if you have this condition, you have to do this and this and this. But that may not be the future. The future will be very personalized and very specific to an individual based on their risks and based on their conditions.
Well, that's a great point. And in the last few minutes that we have here, what else should we cover that we haven't?
Well, some of the exciting things that we are doing here, I recently launched my startup in the autism space. It's called Sirica Therapeutics. We are building a device system to treat autism, and that's a very novel way of treating. And so if anybody is interested in the autism space, and please check it out. It's siricatherapeutics.com. We are excited about bringing this new technology to the market. We have done some preliminary tests, and it looks fantastic. And so I'm very excited about that.
That's great. So, how best for listeners to get back in touch with you?
The best way is through LinkedIn. LinkedIn has all my information, and just send me a connection request or send me a message, direct message on LinkedIn, and I'll get back to you.
Great. We'll put your contact details in the show notes. I want to thank you for joining us today and hope to have you back for a follow up soon.
Thank you very much, Hal. It's a great pleasure to be on this podcast and looking forward to more opportunities.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. Paul T. Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.